So the first thing we're going to do in assessing the thoracic spine is we're going to observe it, all right? And by that I mean we want to see how much kyphosis there is or how flat it is, all right? If you see a lot of kyphosis, that would be indicative of a patient needing what movement? They're going to need extension, right? And if they have a flat area, even in a patient who looks kyphotic, that's going to be an area that's probably in need of flexion. So just get an eyeball assessment of what the thoracic spine looks like. Now today we're concentrating in here, but of course you're going to look at the entire thoracic spine, and later on we'll do the upper thoracic. So consider what that part of the curve looks like as well. So once you've done that, the first thing we're going to do is lie our patient prone and make sure they're comfortable, the table's adjusted properly, and ask them to go into a sphinx posture, which is up on their elbows. So put your elbows up on the table with the elbows slightly in front of the shoulders. So move the elbows forward a little bit and kind of relax in this position. All right, you comfortable? Is it okay to open that up? I want to open that up so I can really see what's going on. All right? Tuck that on. So there's a few things we want to look for. Just hold your head up so I can, there you go, like that. We had an idea of what that thoracic kyphosis looked like initially. So what should happen to the kyphosis when the patient goes into this position? Should decrease, right? So does the kyphosis decrease? Well, it does a bit in here. In this region, it seems like it's pretty much like it was when he was standing. Also note whether or not the pelvis can rest comfortably on the table. So we can reach around underneath and see if the ASISs are on the table. In this case, they're off a little bit, right? So that can come from two things. It can come from the lumbosacral spine not extending well, and or the thoraco-lumbar spine or part of the thoracic spine not extending well. Also look for the hinge. Sometimes you'll see a patient kind of hinge at one spot, which means that the areas above and or below it are probably hypomobile as well. Then we're going to do our palpation. So for the first part of this palpation, you're going to stand facing the patient's feet, going to make a broad contact, a soft hypothenar or just a broad heel of the hand contact, starting up at around T4, T5, and reinforce it with a thumb index web. And just gently spring from posterior to anterior, move down a segment or two, spring, kind of get a sense of how much give there is, and just work your way down till you get to the thoraco-lumbar region. Now we're doing this for mid-thoracics, but since we're doing this palpation, I'm going to take it all the way down to the sacrum, which is where we would normally do that. All right, very stiff in here, and you can see the thoraco-lumbar hypertrophy as well. So when we get down to that thoraco-lumbar area, we're just going to turn ourselves around. Ergonomically, it'll fit better. We're going to use the other hand, and we're going to work our way up to the area where we stopped on the way down. So there's my contact right over lumbosacral, and I spring, and I spring, and I spring, and he's pretty flexible coming up in here. And again, I encounter that stiffness again when I get to that thoraco-lumbar area. So this ASIS being off the table is probably more related to this than it is to actual restrictions in the lumbosacral region. So what I'd like everyone to do is to start off by just observing the thoracic spine and then putting your patient into the sphinx posture and then doing the palpation. Okay, so after we do our observation and we do our sphinx palpation, now we're going to go in and palpate individual levels, right? So I know you've done this palpation before. I want to revisit because it's an important part. The assessment is an important part of figuring out where you really need to do the adjustments, which are going to follow this after we get through with this practice. So we're dealing today with the mid-thoracic spine, right? And just some reminders about some basic palpation. When you palpate for movement, you want to really engage your entire hand so that you're not putting all the pressure on the palpating partner, which in this case is going to be the thumb. Right? So if I put my thumb right next to the spine, let's say right over a mid, let's say T7, T8 area, right? So I'm right over the spine. What I'm going to do is extend my patient back, bring the head back a little bit over my thumb, but look at the rest of my hand engaging the patient. I can push with all of my digits, and from here I can push forward, creating anterior sagittal glide, which of course is extension, where I'm causing extension to occur. With my thumb right next to the spine, I'm just going to move it up a level, right? And I'm going to compare what I just felt with the level above. So I'll extend my patient back over my thumb, and again, push forward to create that anterior sagittal glide. Now I'm going to come down a segment. So I'm palpating at 3 segments, right? 3 levels. And bring my patient back and push forward. All right. Back to my middle segment. While my thumb's in the same place, I can create rotation, and I can again spring on that. Come up to the first level, level above, and spring, and come down a level, and then spring. Of course, I'm going to do all this on the opposite side as well, just by shifting positions and using my left hand on the left side of the thoracic spine. While I'm here, I can also do a coupled movement of anterior sagittal glide extension and lateral flexion. So with my thumb in the center, between the 3 segments, going to laterally bend to the left, and in left lateral flexion, I'm going to bring my patient back and produce some anterior sagittal glide. I'm going to come up just like before, left laterally flex, bring my patient back into extension and anterior sagittal glide, and then come down to the lower level, left lateral flexion, bring my patient back, and anterior sagittal glide. Again, notice how I'm using my entire hand. You can also palpate lateral flexion, if you will, in a more traditional way. For left lateral flexion, I'm going to bring my thumb to the left side of the spine, inner spinous space, right next to the spine. I'm going to again engage all of my digits. I'm going to use my hand and my thumb to create a fulcrum over the contact, and then I'm going to use my entire body to create a fulcrum and feel the range of movement and the quality of the end feel in left lateral flexion. So in review, and we're going to break out and practice this in just a moment, you're going to do just anterior sagittal glide at a level, level above, level below. You're going to do rotation, level, level above, level below. And you're also going to do coupled lateral flexion with extension and anterior sagittal glide, 3 levels. And then make your contact on the opposite side and do lateral flexion in that different manner that I just demonstrated. Also rotation, palpate rotation at each of the levels as well if I didn't mention that. So let's break out and practice that, and after that we'll move on to some rib assessment.